Welcome to St. Louis and Me. I'm Michelle Anselmo. Today we're joined by RX Outreach, and Darryl Munden is the president, and he's joining us now. Hi, Darryl.
Hello, how are you?
I'm doing great. Thank you for joining us.
Good.
So let's start right there. What is RX Outreach?
You know, it's probably the closest held secret, unfortunately, in the sense that not as many people know about us as they should. We are a nonprofit mail order pharmacy, and actually we're in the backyard of St. Louis and Maryland Heights. We have 31,000 square feet, and what we do is we provide affordable medication to people in need all across the United States. And when I say affordable medication, I'm talking about some medications as inexpensive as $20 for a 6-month supply.
And when we say nonprofit and pharmacy, is that kind of an anomaly? Is what you have pretty unique?
It is very unique. We're one of a kind. And the fact that we're nationwide even is a greater differentiator for us as well. But the need exists, and it has existed for quite some time. And if you even go back to the days prior to the Affordable Care Act, people have always struggled with access to affordable medication. I often say that everyone knows someone that needs access to affordable medication.
How did RX Outreach begin?
It's a remarkable story. We're an organization that is based on faith. So my predecessor, Michael Holmes, and I were at Express Scripts back in 2009. And there was the idea of taking a program that was under my umbrella and spinning it off as a separate nonprofit company. What we both thought would be a duration of time before the agreement took place and somebody said yes, really moved very quickly. And so in a couple of months, the board had approved and for Express Scripts, and we were underway to take this program that was doing good and standing it up as a separate nonprofit company to do even more all across the United States.
And that was 2009?
That was 2009, and we officially completed the spinoff in October of 2010.
And in the last decade, tell us a little bit about what's changed, what's grown, and really what the needs are and how they are changing.
It's really about the need that still exists, that is out there in the marketplace. And so over this period of time, we have dispensed over 3.1 million prescriptions to people that need affordable medication. We've saved them over $662 million as compared to what they would have ordinarily paid elsewhere. And see, the remarkable thing is when you have a conversation with a patient who's faced with paying $800 for a rheumatoid arthritis medication, and they're about to go to a grocery store and begin to buy less groceries so that they can buy their medication. That's an actual story. And see, on their way there, they happen to receive a call from us. And what we tell them is that it's no longer going to be whatever you were, the $800 per month. And because of a partnership that we have with the manufacturer, it's going to be free. That's what we call life-changing, and it allows somebody to have a better quality of life. So over the years, those same stories by different people get told over and over again. And the joy that we have is being inserted into the script and then being able to positively impact someone's life. It's not that we're just impacting the life of that individual, because they have a family. They live in a community. So there's this 360 omnidirectional impact that we're having. It's a joyous occasion, let's just say that.
Is the need changing as we're in 2020 and looking ahead? Are more and more people finding themselves in need of help like this?
You know, the COVID-19, right, is a challenging situation. We have millions more people that are now uninsured, millions more people that are without jobs. And so to that end, there is an escalated need, and we have responded to that need. We have worked to expand our program guidelines, and anyone that is being impacted by COVID-19 can now utilize our program and take advantage of the benefits. Typically, under normal circumstances, we would have a program guideline that says you would have to qualify, for example, if you were a single person making $50,000 or a family of four making $104,000, but we've thrown that out the window. And we've said that the most important thing is for people to get the medications they need. And there's no better way to do it than right now with a mail order pharmacy like ours.
Well, let's take a closer look now at RX Outreach's response to COVID-19.
In response to the COVID-19 public health emergency, RX Outreach is making its medications temporarily available to those individuals and families who are now facing severe financial hardships. RX Outreach is the nation's largest nonprofit mail order pharmacy, serving people across the United States and the U.S. territories for over 10 years. Our mission is to make sure people have access to affordable medication. And now, our mission is more important than ever before. It is important that during times like this, you and your loved ones continue to take your prescribed medications. And for those who are ill or are immunocompromised, staying away from public places is imperative to the health and well-being of us all. We are a mail-order pharmacy and can help if you're unable to leave your home. To enroll in our program is quick, easy, and confidential. Just go to rxoutreach.org or click the button below. Please know all of us at RX Outreach will continue to pray for the health of each and every one of you, your families, and our nation.
Darryl, who can qualify? We just watched the response to COVID, and you had mentioned that a lot of the barriers are broken down. So tell us a little bit about folks who are watching that wonder if they could be eligible for this.
What I would encourage people not to do is not to suppose, not to presume that they don't qualify, and to take the step of contacting us. And they can do that in a variety of different ways. We have a robust website that people can go to and actually do an enrollment online. And then we also have in that 31,000 square foot operation, we process the prescriptions from start to finish. And so we have about 80 people there just waiting for a call. And you can call there and actually enroll in the program, and we will reach out to your doctor to get the medication that you need. We know that people struggle day to day on a variety of fronts. And what we want to do is make sure that we make it as easy as possible for individuals needing help to be able to get the medications they need. And so we bear a burden that others are not willing to bear. And we will take it upon ourselves to reach out to doctors and get the prescription you need. We will have your prescription transferred from another facility to ours. And so we will also keep you alerted as to when you need to refill or renew your prescription. We want to take the burden and the cost of medication off the backs of the individuals that need the help.
Do you have to be uninsured?
I'll say this, just because you have insurance doesn't mean you have to use it. You need to think about what is the copay and whether or not there's a more affordable option available, like an RX Outreach. We just had a patient who called our organization, and she was going to be taking a medication that was going to be $756 a month. The medication through us was going to be $80 for a 90-day supply.
Wow.
And that's kind of the nature of insurance and how the cost burden has shifted to individuals these days versus, from a company perspective or otherwise, where that burden was shared more equitably, let's just say. We want to make sure that people know to make an informed decision, to look at whether or not a $15 90-day supply versus your $15 for a 30-day supply, and do the math. And we have people that when at the call center that can help guide people to make the right decisions.
How do you keep prices so low?
It's a challenging venture, but we have some great partnerships. We buy about 85% of the medications that we dispense, but we're also part of a group purchasing organization that gives us some wonderful pricing. But then we have other organizations that elect to partner with us. And so that 15% that we're not buying is donated to us. And then what we do is we offer those at very affordable prices. And so the manufacturer has said, I know that this is a more expensive medication in the market and that people need help. And so they come to us and say, can you be that conduit for them, the manufacturer, to the patient, and provide this medication at a very affordable price? And we say yes.
Do you find a lot of skeptics, the old adage, if it sounds too good to be true, it probably is?
You know what? I'm laughing here because I see the searches that people also make on the Better Business Bureau. And the question is RX Outreach legitimate? And so you see that over and over again because the value proposition is so significant that it is almost too good to be true. But what I'm here to tell you, all you have to do is take a look. You can see how we're rated. You can see our partnerships. We're a licensed facility. And we're not just licensed in Missouri. We're licensed in all 50 states. We also have the National Association of Boards of Pharmacy that has an accreditation that also validates and verifies our operation and how we perform our functions. And so there's no question about the quality of the operation and how we do what we do. People have to take the step to realize the benefit.
How do a lot of people find you, first off?
There are certain organizations and groups that we work with. Inherently, people end up going to places that can meet their needs. So there's a group of free and charitable clinics all across the United States. There's a National Association of Free and Charitable Clinics. There are state associations. And then you have organizations like United Ways, 211, where you can get help as well. But there are case managers and a litany of other disease state organizations that we partner with. And then what we want to do is make sure that we represent ourselves boldly in social media and in other avenues. And so I have this vision. I ask our team, I said, so when can we create the community in the social media world where people they stop asking about who is RX Outreach? How do we do that? Thereby, we continue to just perpetually grow and communicate the value proposition. What disheartens me, quite honestly, is that not enough people know who we are. If I may share with you a personal story, because when I look back over my career and my life, and I see where I am today, it goes back to a relationship that I had that was near and dear to me with my grandmother. The fact that I grew up in Virginia and she had 13 children and she was poor. So poor that she could not take the medications that she needed to prevent routine chronic conditions. She lived with us, and I found that there was a time where the ambulance would come, she would go, she had congestive heart failure. That cycle repeated itself. And I would go to the hospital, we all would, and we'd rally her back to health, and she'd come home. But there was this one time where she went, and it was different. And see, it was different, I wouldn't go. And then when I did go, was the day that she died. And having a loved one pass away while you're sitting at the foot of their bed changes you. And so it's that passion that I bring to this job and the desire to have others not have to encounter the hurt and the pain that I did, and driving to make sure that more people know about us and then can get others the information they need, if need be, to get the affordable medications they need.
I was going to ask you, this does sound like your passion, and do you find that a lot of folks, part of this nonprofit, this is a lot of their passion too?
It is. It's amazing. I mean, you can walk in and you can have a conversation, and what you're going to hear people talking about is service to others and the importance of us serving others in the right way. There's the connectedness. We have to make sure that we serve each other at the organization right, so that they can serve those that seek our services in the right manner as well.
Well, Darryl, let's take a moment. We've kind of laid out some of the benefits and show some of our viewers before we talk about some of the community partnerships.
Great.
All right, let's take a look at those benefits.
RX Outreach, America's largest nonprofit mail-order pharmacy, has a plan to help you save money on prescription costs. This pharmacy benefit is called Serving Those Who Serve Others. This benefit is available to you at no cost through your company. It gives you and your family members access to affordable medications, whether you have other prescription or medical benefits or not. You may be concerned about affording medications due to rising costs. This benefit gives you access to over 1,000 medication strengths at prices that are 70 to 90% lower than average retail cost. Our prescription benefit includes medications for high blood pressure, high cholesterol, depression, and more. Pharmacist consultations, simplicity, with no coupons or discount cards needed. Medications delivered safely to your door, free of charge, and an additional 5% discount on our prices. This benefit is free to you and your dependents. You serve your clients and customers. Let us serve you. Please contact Bridget Sims, RN, 314-627-6139.
So we've laid out the benefits. Now let's talk a little bit about some of those community outreach programs.
There are more people in need in different groupings and clusters in our communities. And so I'd like to talk and share with you a little bit about one that is immensely important but often neglected. And that's going to be what we refer to as our Healthy Reentry program. And this is where we work with Department of Corrections and health providers in correctional facilities to make sure that when someone is released from a correctional facility, that they not only get the 30-day of medication like they do here in the state of Missouri when they leave, but they get an additional 60 days of free medication, which will help to bridge them from the time they leave to the time they can find a correctional home and not be without their medication. And see, that's critically important because we know that when people leave, there are a lot of different things that they have to struggle with. And here again, it's that premise of, well, let's leave and try to make that a permanent or more permanent experience. And we know that that can be trying because 52% of the people that we have served previously in the state of Missouri from 2016 to 2019 were taking mental health medications. And so those are the individuals that are coming back into our communities. And without a program like Healthy Reentry, they would be without their medication. They would be at risk. And we know for a fact that we've had a positive impact on people leaving and staying at home.
And what other programs, are health and wellness and outreach programs do you offer?
This is an area where it has allowed us to transform how we can take health education from a more regional, local perspective to a national platform. And where we're wanting partnerships to engage in us being able to tell people about how do you live healthy, how do you eat healthy, if you have diabetes, how do you exercise if you're a senior? And so these are different ways that we can communicate with individuals of various ages and the like to help them live a better quality of life. And there's another program that we started that's called Serving Those Who Serve Others. And the intent is to originally to help organizations, nonprofits, that could not and did not have access to affordable health options, pharmacy benefit plans, and the like, or they had employees that they couldn't extend that benefit down to completely. And so what we said was, hey, we're on the front line with you, and we want to make sure that we can help not only our patients, but help you fulfill your mission. And we're going to do that by making our RX Outreach pharmacy medication plan available to your employees that don't have access to medications and affordable medications. And so that was the genesis of it. It was about that relationship and for that, for those nonprofits. But what we've come to see is that it's in the food industry, the restaurant industry, it's in the grocery industry, it's in, that there, the hotel industry, that there are pockets of people working day and night, in some cases, literally, to provide, but not having the essential of a health plan and medications being supplied. And so we take this to those types of organizations as well, and we say, help us help you fulfill your mission and have their employees routinely show up to work, because there is an impact.
What are care clinics?
Care clinics, or the free and charitable clinics, are clinics that we have relationships with all across the United States. And you'll see them in rural areas, urban areas, but it's, well, where do I go if I need to see a doctor? And so these clinics go well above and beyond to provide diagnosis and treatment and care. And but oftentimes they are still left with the question, well, what am I going to do for the medication? Where am I going to go? There are some free options that are available, and we encourage anyone, any organization, that if you have an option that's a very affordable option that is free or whatever the case may be, use it.
So let's take a look at a virtual tour of RX Outreach to show how you guys do exactly what you do.
America is in an epidemic.
Imagine having a chronic health condition and not being able to afford the actual medication to treat it.
It happens a lot.
It is the medicine that is keeping them alive, but it is the price that is causing them a lot of pain.
Nearly 1 in 2 people need medications daily, but millions struggle to pay for it. It could be a relative, a friend, a neighbor, or it could be you. Imagine having to decide between putting food on the table or paying for your child's medication. Imagine being a veteran and needing PTSD medication. Imagine being retired and cutting your blood pressure medication in half because you don't have enough money for a full month's supply. Millions of people face these harsh realities every single day. So how do we break down the barriers? Welcome to RX Outreach. RX Outreach was founded on the belief that every American deserves access to affordable medication. We are the nation's only nonprofit, fully licensed mail-order pharmacy. Through our relationships with drug manufacturers and donors, we've provided over 2.7 million life-saving prescriptions to those in need. But the task is not easy. Since our inception in 2010, RX Outreach has been helping our patients by reducing the financial burden of taking the medication they need. Today, we get approximately 8,000 prescription requests every week from doctors and patients. Through our automated technology and skilled staff, we deliver medications to people that help them live the best quality of life possible and keep thousands from costly hospital stays. So how do we do it? Our entire process is designed for efficiency and accuracy to make sure that every prescription we fill is right and delivered to our patients promptly. Our personnel and pharmacists check every prescription before being entered for processing. Our entire team of data entry operators enters the prescription into our computer system. This same computer system drives our high-speed fulfillment center. Our automated fulfillment system dispenses the medication, and barcode scanning technology ensures all prescriptions are filled accurately. On average, the patient generally will have the prescription within days from the date the order was received. Our mission is to make medicine affordable to all those in need in the continental U.S., territories, and islands. We've only begun to break down the barriers that exist. There are still millions of people needing a reliable medication solution. Please, don't let any person have to decide between feeding their family or taking their medication. Together, we can break down the barriers and help people gain access to the medication they need. Together, we can make a difference.
Well, Darryl, we've learned so much today, and it seems like just picking up the phone or looking online are going to be the easiest ways for folks to find more information.
That's correct. I talked about the website. It's www.rxoutreach.org, and it gives an array of information and access to include the ability to enroll. And the phone number to our organization, where we have call centers waiting for your call, is 888-796-1234. And people can call and be served with a live person if that's their preference. And so the other important thing that I would like to say is that it is not without dollars and support from others that helps to make this all come together. And that's where we need partners. We need individuals that understand the need, that have experienced the pain and heartache, that have experienced it for themselves, the tragedy of chronic conditions or the loss of life. And see, on that same website, there is a button to donate. And I encourage everyone that has the means and the desire and knows the need that exists to go there and click the button and give, so that we can continue to have the impact that we have had, an even greater impact in the future.
Well, thank you so much for your time. The need is there, and very, very inspiring to learn what this organization and nonprofit is doing for the whole country.
Well, thank you.
And that'll do it for us on this edition of St. Louis and Me. Until next time.